We'll have our review session tomorrow at your time, 6 p.m. your time. It will be recorded. I did get several emails today about my recordings. So when you guys click on them, it says private and you can't preview them.
Right.
Was anybody able to see them? I'm seeing some shaking of the heads. No. Anybody? All right. So let me do some troubleshooting with Dr. Lundy and we will figure that out. But my recording will be on there. So if you miss it, you should have seen on the announcements, we have all the recordings that we're doing for our exam reviews this week. Make sure you guys attend them. They're really helpful. Those people that did really well last exam,
They're gonna keep playing the game.
you know how to, you know how helpful they were, I think. Our study guide has been out there. I know there is a study guide that is circulating around that has colors and numbers and something like that. Please do not follow that one. That was not supposed to be shared, but same content. I can only ask you guys to do the ethical, the right ethical decision making. And I know it is being passed among students. So anyway, our study guide is the one I want you to follow. It's on your announcements. And if you have any questions on that, you of course let me know. Let me see, what else can we start with? It looks like we're having most of our people are joining. I'm going to take quick attendance. I will tell you there are some students that are not, that the students that I see every week, I know now by sight. So it's really easy for me to identify who hasn't been here when I see a name come across and I cannot see them. So I need you guys camera on as usual. Dr. Brown, as you know, was with us last week. She can pop in at any time. She will send notes to your deans and let them know that you don't have your cameras on. I think I've told you this before. I really don't care. Well, I shouldn't say I don't care. I care, of course, but you can come to our class wearing whatever you want pretty much, right? But I know a lot of us are coming off of work. I'm coming off a long day of work. So, you know, I either have scrubs on or a shirt that I was able to grab real quickly. So just understand that I know everybody's coming with something. I don't expect you to put on some fancy outfit for a Zoom call, but I do expect to see your guys' face so that I know who you are. All right, real quickly, Claudia, are you here?
Yes.
Great, thank you. Williams, I don't see. Luce, I saw you. Hi. Rachel, I think I saw you. No, I didn't. Nope, no Rachel. You ready, Daylin? No, Daylin. All right, Marissa. No. Oh, there you are. I see you. Thank you.
Thank you.
You're good. Andrea. Do I see you, Andrea? No. Alrighty. Larissa, I saw you. Where are you? Just wave hi. Hi. Alrighty. Christy, I just let you in. D'Amber. There you are.
Right here. Hi.
Hi. Alrighty, let's see. We're at Lauren. I saw you. Angela. There
Here.
you are. Greta was on earlier. Where is she? All right, well, I don't see her. Rose Angel, I don't see you either. Gosh, attendance is awful. All right, Albert, I saw you. Thank you. Margarita, I saw you.
Hi.
Hi. Robert, there you are. Thank you. I confuse you and Albert because you know why? You both have this dark beard and a bald head. Or it might not be bald. Maybe you shave it. Sorry, I didn't mean to say you were bald. But Felicia, there you are. Awesome. Sharon, I see you. Your camera's not on, so try to fix that. Joe, I see you. Duana. Nope. And Hetty, I saw you come in. Where are you? Somewhere. Okay. All right. So guys, I started the class telling you about our, then I just gotta mute somebody. I started the class telling you we have a review tomorrow, 6 o'clock your time. It's 4 o'clock my time. But what I will tell you is there's a bunch of reviews going on this weekend. Please attend them. If you want to do one-to-one tutoring with me, all you have to do is send me a text or an email, and I'm happy to meet with you one-to-one. We can go over the topics. There's a lot of content on it because the lecture of our last exam, we didn't have a full class. I tried to cover the hot topics last week, the ones I want you to focus upon, but I do expect you guys to be doing the reading and know that I'm going to use that as a basis. So that's good. Do we have any questions for the good of the people yet? All right, we're going to start the class tonight a little differently. And what we're going to do is I'm going to have you guys be the nurse educators for each other. So what I'm going to do is I'm going to send you into groups. We're all going to go onto this website. Okay. The first chapter we have tonight is environmental health. So environmental health nurses, anybody want to take a jab at what you think they do?
They look at their environment, like fire, maybe.
Sure. Good. It has it right in there for you. So they look at the environment and they help to prevent things in the environment that are going to be problems. What are some of those problems? If you didn't do your reading, and I'm not going to ask because I'm sure I won't want to know, but if you didn't do your reading, what are some things you think environmentally we're going to see as nurses?
Natural disasters,
Yep. Welcome, Williams. Go ahead.
disease outbreaks,
Good. Outbreaks. What else? There's a big one that it sort of has gotten into the back burner recently, and I don't know why. It's a really important one that a bunch of you are going to tell us about, but lead-based paint is a huge one. As a community nurse, we go into homes, we have to really assess, and who are we worried about with lead?
children.
Children.
Kids.
Good. Kids. Good. So you guys are going to look into some things like that. One group is going to do lead. One's going to do natural disasters. One is going to do chemical weapons, which is a big one. And one is going to do food safety, because we see those outbreaks. And as environmental nurses and community nurses, we have to figure out what are we going to do? What are interventions? I want you guys to think about, because this is an introduction for the 3 chapters this week, really blend really nicely together. So here's what we're going to do. I'm going to give you a website. It's a CDC website. And what it does is it covers these environmental hazards that I spoke of. So I'm going to share that website in the chat. And let me just put that in there. Let me just omit the rest too. Okay. So in the chat, I'm going to put a website. This is where we're going to go and get a lot of information for what you're going to do. So what we're going to do is we're going to go to this website. I'm going to randomly assign you guys to groups. Okay. And then what you're going to do is you're going to find out for me, or you're going to teach us about 5 for each topic that you have. So each group has 1 topic. Okay. We're going to get 5 things we're going to educate our patients on as a community nurse related to whatever environmental hazard we have. We're going to come up with 3 nursing interventions. We're going to come up with a primary, a secondary, and a tertiary prevention. And you're going to identify for us who's at high risk. Okay, so you're going to do this as a group. I give you this website because it's a good starting point. All of these topics are in your textbook too, so it'll help you review. And I'm going to give you maybe 15 minutes to get this all together. What you're going to do is you're going to put it on a Jamboard. Do you guys remember the Jamboard we did a couple weeks ago? No? Okay. I'm going to share my screen with you and we're going to take a look at it. So here's the website you're going to, but we're not looking at that. Okay, so the first one is going to be lead. Okay, I'm going to share this with you. You guys are going to be able to access this. So what you're going to use are these sticky notes. You click on sticky note, and so you can describe about lead for one. And then your next one is going to be one of your interventions. You're going to save it. You can change the color if you like pink or orange or whatever, right? So you're going to have another intervention here. And so what's going to end up happening is when you're all done with your sticky notes, now the sticky note is the button right here underneath the arrow pointing that way. So does everybody see it on the left-hand side? Good. So that's where you're going to put your information on there, okay? And I want you to work as a group because everybody's going to contribute something different. And we're going to, so our first group, and I'll do it, I will, if you want to delete, you just right click and delete if you write something wrong. And if you want to do something where you want to write just words and not do a sticky note, there's a button down here. It has a T in it. You click and that'll give you a text box so you can text there. So, but I ask that you guys do sticky notes because it just makes it easier for everybody to see. All right, so we're going to do that. And this is going to help us go through that chapter. And you guys are going to be actively educating us. Okay, so we have lead, we have chemical weapons, we have food safety, we have natural disasters, and we have safe water. Okay, so we're going to look at our water and how that impacts our environment. I will come in and pop in. So there's 10 slides on here. You're only doing one per group, right? You're doing whatever you're assigned. And you'll just fill this up. And then when we come back together, then you're going to give us like kind of what you guys figured out and what, you know, so again, it's 5 things you're going to educate, 3 nursing interventions, primary, secondary, and tertiary prevention for this, and who's at high risk. Everybody got it? Good. Okay, so I'm gonna share this with you guys now. Okay. Right. Oops. Okay, so here it is in the chat again. Now this is your Jamboard. This is where you're gonna click on so you can do all those sticky notes and all that stuff. Okay, everybody see that? I'm hoping so. Last time we had some problem with privacy. I don't know why everything's private. I don't mean it to be. All right, so I'm going to randomly assign you guys, okay? And the first group that gets assigned is group 1 is going to do lead. Group 2 is going to do chemical weapons. Group 3 is going to do food safety. 4, natural disasters. 5 is safe water. All right, so we'll break out randomly into 5 groups. And the reason we're doing this is because I want you guys to really be doing some of the research and the talking, and then I'll enhance what you guys find, okay? So I'd like you to be a little more actively participating. Okay, so we're going into our 5 breakout rooms. I'll jump in with everybody. If you have a question, just let me know and I'll come back. But everybody should be working on that one Jamboard depending on their topic, okay? All right, here we go. All right, I'm just joining in. Do we all understand what we're doing for this one?
Yes, we're in group 5, right? For safe water?
Mhm.
Oh,
Oh,
thank you.
okay. Mhm.
And so what you're going to do is you're going to use that website, look under there. I think it says water safety. It's
Can you
all
put
out
it in this chat? Because it's not in this chat. I didn't see it.
for the website.
Yeah.
Yeah, sure.
Mhm.
Chat.
When I go to the CDC website, it says
Mhm.
safe water for community health. That's okay, right?
So it shouldn't be the CDC website. What it should be.
Oh, well, the one that you put in the chat.
Yeah.
Yeah.
Okay. So Sharon, I'm going to send it to you directly and then.
Okay.
Oh, no, that was the Jamboard. Hold on a sec. Oh, come on. Oops. And then this is just like a way to start it, you know what I mean? And then this was in your textbook and your reading for the week. So you can use anything you learned from the book or just pull up the book and look at it.
Okay.
All right, there you go. Sharon, you see that?
Yeah, I got it. Thanks.
Everybody else have it?
Yeah.
Okay. Alrighty, hold on. I'm at the main session. Alrighty. So you guys work on that for a little bit. I'll come back in a little bit.
Okay.
Okay, Margarita, you were assigned to a group. They're working on a group project. Can you hear me? Margarita?
Yes.
Hi, so you were assigned to a group because we're doing a project where they're looking at the environmental hazards depending on your group number. So I'll just randomly assign you to another group. So there's a website that we're looking at and we're gonna give us 5 educational things that we're going to teach about with our environmental hazard, 3 nursing interventions, primary, secondary, tertiary prevention measures, and who's at high risk. So I'm going to assign you to, let me see where you
Is that website?
I'll put it in the chat for you. Can you see the chat? I'm going to put you with 5, and that's going to be safe water.
Safe water.
Yep, water safety. What do you mean? Ask her. I mean, I don't.
Or I guess like remember when we were in elementary school, or if you've ever worked at a nursing home, you know, to stay away from windows during like tornado drills, like
Yeah.
finding safe places.
All right, stay put. Best way to stay safe is emergency. So I wonder how she's gonna do it. Is she gonna be like for us? Are we each gonna have to? Oh, Professor Alani. Hey, so for like the sticky notes, are each one of us gonna kind of jump in and educate, or how do you want?
You guys can do it either way. If you want one spokesperson, then you have one. If you guys all want to contribute your own stuff, then that's fine too. I know some people don't like to present to other people, so it's up to you.
Yeah.
Whatever you're comfortable with.
Yeah, we could each take a since there's 5 things for education, we could each take one and do like a little educate thing on if you want to do that. There's 4 of us. One of us can grab a couple.
And so probably one person could, with their education, one do primary, somebody do secondary, third to tertiary, you know, just split
Okay.
it up if you guys are going to do it that way. So you guys have the website that you're looking at, right?
We're
All of
looking at the CDC.
great. And all the information is also in your book, so you can use that if you get stuck and you don't know, they may give you some interventions or education techniques.
All right.
Good.
Yes, ma'am.
All right, I'm gonna come back in a little bit.
Okay.
All righty, I'm just checking in. How are we doing here?
I'm just trying to figure out how to put them on here correctly.
Oh, the sticky notes?
Yeah, because I'm on my phone doing it and it's
Oh,
being silly.
yeah, it's hard on the phone. Did you guys go to the website?
The
Yes,
CDC.
ma'am.
Okay. And then, what's your topic again? I forget.
Food safety.
Food safety.
Food safety. Okay, that's a big one. Because we're gonna see outbreaks in communities, you know, particularly like college campuses is a big one. Where else might you see it? In a nursing home, you might see it where there's large groups of people.
Oh,
Oh.
daycare.
Daycare, schools, wherever they're feeding a large group of people. Okay, so I want you to think about those. What happened to Robert? Did he go off somewhere?
I think he said he'd be right back.
Okay. All right, so that's what I want you guys to focus on. I want you to know that it is in your textbook as well. So I want to make sure that you guys are using that as a good resource if you need help with like interventions or some things to educate on. You can use other websites too if you want to Google stuff, just to get you sort of familiar with it, okay?
Okay.
I'll leave the room, I'll come back. All right, how are we doing here?
The
I
CDC.
can't
with the
write
leaf
on the
on top?
jam board.
The loose that I'm gonna need it.
What'd you say?
Leaf on top.
You're on the website?
Yes, we're on the website and writing sticky notes.
Great. I want you guys to know this topic is in your textbook too. So if you need a second resource, that's a great one. And you can also Google if you need to, if you get stuck. Some prevention techniques, that's an easy way to find them. And the group that'll be at high risk. Your topic is what again?
Chemical warfare.
Chemical weapons.
Weapons.
Right, chemical weapons, yeah, so that'll be chemical warfare, they're used in warfare. If you want to pick one, that might help, but there should be a lot on that website. So I want you guys all looking at it and participating the best you can, okay?
Okay.
I'm leaving you guys, bye. Alrighty, how are we doing here?
We're gathering our thoughts together.
Working on it.
Working on it. Did you guys get to the website okay?
I didn't, but we're just basically giving Greta the information and she's putting it on for
You
us.
typing it up?
Yeah.
Okay, that's good. Who's gonna present your information?
Mm.
Who knows?
It doesn't matter. I can do it if you guys want.
So you guys can present as one group if you want and everybody contribute, or if somebody doesn't like to do, public speaking, then I'm okay with however you want. Just make sure that we're looking at some educational things. What have you guys found for education?
For education, we were saying for them to check like the year that their house was built, and then if any of the paints contain lead, also checking to see how old their pipes are, like if they're made out of copper pipes or lead pipes, anything like that.
Good. And then think about some primary things you can do. Remember, primary is going to be before they have the lead paint in the house.
We were discussing for primary and secondary whether exposure evaluation would be primary or education would be primary.
Education is always primary. That's always a real
Okay.
safe one. It depends on, you're not going to say you teach a group of people that were buying a home would be your primary. Okay. If you're going to do anything like you're buying a house, you go into the house, that kind of thing.
And then tertiary would be like management, like prevention management.
Well, you're going to sort of do something to help with the lead paint in the house.
Okay.
Or help the child have follow-up care because they've been exposed to lead. Makes sense?
So we could do like exposure elimination or referral to like other sources, I guess.
Well, I wouldn't say
like
exposure
resources.
elimination because that's going to be really hard. Think about putting that into perspective. Like, how are you going to tell a family, okay, now you need to get out of the house, right? That's not going to be necessary.
They're gonna panic.
Right. And they're going to say, get out of the house. I paid my month's rent already. You have to put it in perspective of people like this was really happening. They're not going to be able to just say, okay, let's leave. Some people are lucky enough to have families or other places they could stay, but not everyone. So keep that in consideration when you're thinking about what you could do tertiary wise.
Okay.
Okay. All right, good. I'm going to leave you guys and I'll come back in a little bit.
Because they usually
Oh,
aren't
you know, we
as
can't,
accessible.
we can't forget, in the case of disaster, like, medications for patients, like they have to have enough medications to get them through a couple days.
Make sure to ask for extra scripts to be filled.
Mhm.
But I want you guys to think about something too, when you're doing nursing interventions, or when you're talking about natural disasters. Think about the impact that's gonna have on the healthcare provider that's
Mhm.
dealing with this, okay? So are they involved in it? Are they a member? Are they from the outside? You know, how are they? How can you help them as well, not just the community? Because sometimes as nurses, we have to help nurses, right? Because they're part of our
Mhm.
community. So I want you guys to focus on that just a little bit. I don't see anything on your jam board. Are you guys having trouble doing it, or are you just gathering all your thoughts? before you do it?
Yeah, we
Great,
can,
okay.
we can go ahead and go on there and do that.
No, you don't have to. I just want to make
Okay.
sure you guys are comfortable with what you're doing.
Yeah, we're just kind of writing it down and brainstorming right now.
Great. Okay, good. All right.
Nurses help nurses.
That one, it has a pamphlet and everything.
Oh, that's true. So we should do that. See disposed. Okay. Let me add that. So let me put, and then I'm gonna change the high risk one to the seed exposed people.
You guys are doing chemical weapons, right? So I want you to focus on chemical weapons. What some things I want you to think about for safety. I saw your jam board. You guys are doing an awesome job. Some things about safety. Who are we going to be worrying about? Who are we going to be educating? Thoughts?
Like military or fishermen.
Military, yeah. People who are assembling guns. I don't know.
I wouldn't say assembling. What I would think about is who's going to be exposed to chemical weapons.
Mainly either mainly the workers. So
Could be workers, yeah.
also the people that do analyze the area itself for for leakage and any other type of maintenance per se.
Or the
Okay.
transporters.
Good. So think about how you're going to educate them, and what might you remember. They may know nothing, right? They may know nothing. They may just go to work, do their thing, and leave. So what are some things we would look for and say, uh-oh, there might be an exposure here? When you're doing your interventions, I want you to think about that. What might you start to see from people exposed to it?
The signs and symptoms.
Like what?
Wouldn't it be a skin
Blisters.
rash?
Like anaphylaxis.
You might see rashes. You might see anaphylaxis. I wouldn't
blisters.
focus too much on. What?
Burns or blisters.
Burns for sure. And if you're looking at primary, who are you going to teach to prevent this exposure?
Could it happen discoloration of the skin or hair loss?
Well, depending on what kind, sure. But think about what group of people are you going to try to prevent this for?
Yeah.
Right? It may not be those that are necessarily, maybe could you do it as a primary prevention to a new employee orientation? And teach about it, educate them about what to look for, things like that, because they're new employees, so they wouldn't have been working there yet, right? Okay, so think about things like that. All right, good work. You guys are doing a nice job.
Like risk of like waterborne illnesses that people like children, I guess, or people can get when
So
they're
I
swimming
put
in
at
public
risk for
pools.
I put at risk all populations because it is.
Bless you.
Yeah. So this is. So you guys can look. I put those three up there.
Yeah, so if you're talking about safe water, you're right, it can be across the spectrum. Where are we gonna see maybe problems with water? What kind of communities?
Like the
Rural
beaches
areas?
or your households. It just, I think it really depends.
It everywhere, like the
Yeah.
beach. Like I think it's everywhere.
Sure. You can have it in a clean home. You can have, tainted water if something's gotten into the water, right? And think
Yeah.
about times when has anyone ever had like an agency contact you and say, boil your water for the next 24 hours?
So
'Cause that's happened to me.
okay, so what type of prevention would that be? I put it as tertiary because it's already contaminated, maybe if
Yeah.
it's already okay.
Mhm. Yeah, I mean,
Okay.
it could go secondary because you're minimizing the complications, but you already got a big problem if it's in
You already got the
house.
problem though, right?
Yeah, you already
Yeah.
have the
Okay.
problem, so just be careful on that. On primary prevention, who would we teach to and how could we do that?
Let me see
To
what's the
teach
worst
like
apple.
children and certain adults that may not know how to, wash their hands properly.
Oh yeah, like hygiene, it could be a problem.
Mhm.
We
But
need
you
to
know
put-
what,
we can
think
make
about the
these
general
stickies.
public too, right? Because even if someone's well educated, they may not think about water safety because they're an engineer, so they don't even worry about the safety of their water, or someone else is in charge of the house and they just come home and so think about that too. Who can be a part of this as well. Good, you guys are doing a great job.
Those living in close contact areas.
Yep, I saw that. I see that too.
How are we doing here?
Whoops.
I was gonna look at your
Right.
Jamboard and see how you're doing.
It's all over the place.
Ooh, somebody likes to color. Who likes to color?
It's probably me. It's my phone.
Yeah.
I can't figure the.
It's okay. The lines
My
all
Zoom-
over. Makes it for fun.
Big blank sticky note on there.
Okay. Yeah, you guys look like you're doing well. You have a bunch there. Well, you have a couple empty ones too, but good.
I just don't know how to delete it.
Okay. So what kind of education are we doing with this?
Hand washing, proper way to store food, and refrigerator temps.
Use of a food thermometer.
Good.
Hey, there it went.
What's a common one that you see with food safety in large settings? What's something that you see a lot of times that you'll hear in the news?
Hepatitis A. That's what I hear. But
What'd you say?
hepatitis A, but I don't think that really has anything to do.
E. coli.
E. coli.
E.
Good,
coli.
good.
Yeah.
Yeah, E. coli. And, so think about our primary prevention. That E. coli, a lot of times it's widespread and it's in meat from a manufacturer, right? So think about when we're teaching, who are we teaching to? Not just, we're teaching the general public what they can do. What happens to those factory workers when they first start, right? And we tell them, this is how we don't cross-contaminate, this is how we make sure, so all those kind of things. So you could actually be an occupational nurse in a lot of the factories that are doing food distribution, because there's tons and tons of things to prevent and make sure that, when you guys are thinking about that, I want you to pay attention to that as well, okay? But you look good. How much more time you think you want?
I think we're done.
You good?
Yeah.
You good? All right. So let's give it like it's 8:36. Let's give it to like 8:38. Okay. And I'll close the rooms in a little bit. I'm just checking base with everybody. If we need a little more time, I'll come back and let you know.
Cool.
Okay. How'd we doing here?
We're just working on the primary, second, and tertiary. Like I'm giving Greta the information to write.
Okay. You guys want some help? What do you have so far?
Okay, so for primary, I said educate to reduce or eliminate exposure of the lead.
Mhm.
For secondary, identify children, excuse me, that's been exposed and eliminate or reduce their lead exposure.
Oh, you poor thing.
I'm sorry.
No, you're okay. I get the
Um,
same thing after a day of a 95 and I can't even.
Oh God. Yeah, I had my mask on all day today, so
I know, it gets so dry.
oh God. So
You
then
guys are,
tertiary,
go ahead, you're a smaller group, so I'm not gonna be so, if you came up with some intervention, some education, I'm okay with it.
okay, and then can't stop coughing. Oh my God. Tertiary would be like the management of the children that were exposed to lead.
So managing like complications for the kids, right? You
Right.
manage the complications that come from that. So just like come up with one complication that may have to do with lead. Okay. And then you
Okay.
guys can wrap it up because I know it's hard trying to get it together with just 3 people. So, but you're okay. So I'm gonna leave and we'll end in about like a minute. So just,
Okay.
okay. All right, guys, how are we doing here? We're just about coming to an end. Are we ready to come to an end?
I
Yeah.
think so. We are set.
You
I
think you're
think we're
set? Okay.
I think
I
so.
hope.
Okay, good. As long as you think so.
Infrastructure. We could do,
Guys, I think we're gonna come to an end pretty soon. Are we ready?
we're almost ready. We're working on our interventions.
Okay, so if you can come up with 3 or 4 good ones, then don't worry about the 5th one, just come up with like 3 to 4 because,
Well, for the nursing interventions, you said we only had to have 3, right? 3 nursing
oh,
interventions.
yeah, 3, sorry. So if you have 1 or 2 good ones, then you're good.
We have one which is safety.
Okay,
Then we're kind of grasping at the next ones. I know you were talking about how the nurses help as far as like restoring the normalcy and being available to cover in the event of like destruction, something like that.
yeah, and think about the mental health of those healthcare providers, right?
Right.
And what if their families are involved and they're being called to work and they have to go and they, what's that gonna do to them? What intervention can we give to them?
Well, I don't know.
We had a sensory room during COVID.
Oh, did you? Just sort of calm down room. What'd you
It
have in the
had-
sensory room?
We had because it was up by MSU ICU, we had a massage chair, dim lighting, music, aromatherapy. There was a little station that you could make, like the little sensory balls. You could put
Mhm.
beads and stuff into and it was just supposed to help everyone just kind of breathe and calm down during when COVID first started. Public health did it at the hospital and made like a
Good.
little sensory room just to
Yeah,
have somewhere to go, 5-10 minutes, sit in the massage chair and just breathe.
sure. All right, so how could you spin that a little bit? That's a great idea. How could we use that?
Provide assistance and resources for nurses who are impacted by or have family members impacted by natural disasters, such as offering food discussions, group therapy sessions, wellness areas.
Sure.
Maybe.
Think about group discussions, how good that would be to just give the nurses some time to just recoup with each other since they're all going through a similar thing,
All right.
right?
Yes, ma'am.
All right, you guys look like you're about done. I'm gonna leave. We're gonna close out our breakout rooms in about 60 seconds. Don't stress. You guys have worked hard. And so whatever you can give, I'll add in there if I think you're missing something, but you guys have worked hard, so don't worry about it. Okay, I'm gonna leave your room and then we're gonna close out, but you still have a couple more, like 60 seconds to finish up, okay? All right, I'm going to share a screen. We're going to come back together and we'll start with our lead group, but I want to make sure everybody's back together.
Well done.
Everybody here? Hold on, I can't see. Oh, good. Everybody's back. Great. All right, so we're going to start with our first group, which was our lead exposure. And I'm going to pull up our Jamboard board and let's see what they had to say. Tell me something about lead, guys. You guys work so hard. It was my 3-member group, wasn't it? Or were you guys 4? You were 3. I can see you laughing at the bottom. Tell me something about lead. Let's look at our, do you want to go second? Lead people? Just get it over with, right? All right, tell me something that you're going to, first off, who's at the highest risk?
I say children, pregnant women.
Okay, I see here children from and those who live in houses before 78. Remember, that's a big one. Because this is when lead paint was.
Adults that have a profession that have to handle lead.
Yeah, yes, but those would be people in older. So where might we see people working with lead paint? If not families, where else are we going to see lead paint possibly?
Battery manufacturing, paint factories, the paint people that paint houses, they are exposed to lead. The plumbers.
Good, great.
Because before 1960, the
1978. Yep, that's when we started looking at lead.
Yeah.
Okay, so and then we look at that risk group. So we have a couple risk groups with lead. Our primary, though, I want you guys to know, our primary group that we're really going to focus on are those kids.
Okay.
Because the thing is what do kids do? Anyone who has a child, regardless of age, you know, when they're like 2 and 3, what do they do?
Put things in
Everything to the
Put
mouth.
things in their mouth.
everything in the mouth.
Everything goes in the mouth. My
And
daughter thought it would
touching
be funny
everything.
to put a penny in her mouth and swallow it, right? Like how many quarters and pennies have kids eaten in their life? So think about that. And so when they're sitting, or if they're in an apartment and they don't have anything to do because mom and dad are working and their mom and dad put toys in front of them, but they're not playing with the toys, they think it's way more fun to make a hole in the wall, right? Because that's way more interesting for a toddler, right? So think about that, okay? And our big thing we're going to do for our interventions. Any of your interventions, tell me something about your interventions.
Reduce lead exposure, medication administration, education, remove lead containing materials.
Good. We're going to reduce them. We're going to med admin. Tell me just a little bit about that. It's okay. You can't be wrong. It was your own coming up. I want to hear about that though.
I put medication in addition, things like after they do like the assessment where they see the child's development and things like that, or any symptoms that they had from lead poisoning, just making sure that they're medicated to get rid of like or help with any side effects that they do have from the lead poisoning or lead toxicity.
Good. And how about what's one of our primary preventions that we're going to do with lead?
Educate to reduce or eliminate exposure of lead.
Any ideas? Who are we gonna educate?
The parents.
This might be a hard topic to teach to a 5-year-old, don't you think?
Yes.
I'm not sure a 5-year-old's gonna care what kind of paint they have in their house, right? So think about that developmentally, but what might we do as nurses if we were a pediatric nurse? What are we gonna do when we think about lead?
To perform a test to see the levels of lead.
Yeah, you could. Could you also developmentally, on a pediatric nurse, if you're working in a well child clinic, you're going to look at that developmental phases that they're going through. Is anything faltered? Is anything less? Is something showing you a flag? So this is something I want you to think of if you're working with pediatrics and there's some flags and you're like, what could it be? What could it be? Okay. Good work. How about a tertiary prevention? Did we get one?
Just the management of basically kids that are affected by the lead poison with that have already health complications.
Good. Yeah. So you're gonna help with the complications because they're gonna have them, right? So we want to make sure that we're gonna work with those kids and the families again, of course, because a lot of our environmental stuff is going to be family based or industrial based, right? Okay.
Right.
Let's take a look at our next group, which was chemical weapons. Tell me, chemical weapons, what do we want to know about them?
Stay away from it. Try to anyway. Avoid it at all costs.
Okay, good. What is our group that is going to be at high risk?
We're reading that some of the high-risk people are people who handle discarding military munitions. Like one of them was sulfur mustard, or people who are constantly fishing and they're exposed to it.
Tell me about the fishing.
It's deep chartered fishing. They can dredge up some of the ammunition that's in the ocean, I guess the older stuff from plane battles and stuff like that, and they get exposed to the sulfur from there.
Good. What's something else that we're going to think about with, I'm going to do that with my food safety group, forget it. Okay, let's see, what can you tell me about some interventions?
Primary was if they're handling those type of chemicals, to use protective equipment, PPE. If they see any skin rashes or lesions, to follow up with a PCP to see if it was from exposure.
All right, so I'm going to ask the rest of the class. If we see skin issues arise, seeking to see a primary care provider, what kind of prevention is that going to be?
Secondary.
Is it
Tertiary?
It's tertiary because it's already there, right?
Okay, so I'm going to have, since you guys all have a different opinion, put it in the chat and we'll read your answers. Why do you think it's secondary, or why do you think it's primary, or why do you think it's tertiary? All right, so somebody said tertiary already has a problem. Tertiary already has a problem. Now I need, oh, wait, we got secondary because it needs to be diagnosed. You're halfway, we're halfway there, Luz. Think about when we're looking at primary, remember that's when they don't have anything. Secondary is we're like, something's going on. So screening for the problem would be what? Secondary or tertiary?
Secondary.
Secondary.
So why is it secondary?
Because the event already appears, and we need to diagnose what is causing it to treat it, which is tertiary.
We can't treat
We
it
have
yet.
no information about it.
Good.
You got to run the tests to figure it out. So it would be secondary, right?
So that would be secondary because we have a problem. We're not saying that that's what it's from, because we don't know yet. And we're nurses, so we're not diagnosing anything. But we need to assess it, right? Look at it, tell the doctor, this person was exposed, they work in this environment, right? So
Knowing
we're
the
gonna try to,
agent,
what?
knowing the agent that is causing it.
Mm-hmm. Knowing what that patient was exposed to, good. So how could we find that out? What kind of methods are we gonna use to find out what our patients are exposed to?
You can ask them what they did, where they were, what they've been around. Did they know when it started, what caused it? I mean, I guess a history would be the first step, right?
Yeah.
Yeah.
We're gonna, yep, we're gonna do a history, a good health history when we have something like that. So if you're working in dermatology and someone comes in and says, hey, I have this funny rash, it just came out of nowhere. Some things we want to be thinking about is it something just a rash? Is it viral? Is it, so we have all these assessments we need to look at, because just because someone presents with skin issues and they work with chemical weapons doesn't mean it's chemical weapons, right? So we want to think about that. Good. And our tertiary. Somebody from our group.
Follow up with the doctor to manage your condition, disease, or whatever you're exposed to.
Yep.
To manage the exposure.
Yep. So we're going to prevent our tertiary. We're going to try to prevent those complications, right? The best we can, because we're going to try to minimize them. Secondary, we're trying to prevent them from occurring at all. But by tertiary, we already have them, or we have the potential to have them. So that's where you want to be really careful. Good work here. When handling these agents and you see blisters, rashes, go to the healthcare provider. Great. Make sure when handling, a big one for chemical weapons is going to be proper equipment. I want you guys to think about, when you're thinking about any of these exposures, what we've been through with COVID and how PPE has been enormous. I want you to remember that when you're thinking as a nurse, what about these environmental health factors? Okay, very nice work, group 2. All righty, group 3, they give us some fun because they like to color on the page, and that was really cool. But they, all right, you guys worked hard on this one. Food safety, what do you want to tell me about who's at risk?
Elderly, pregnant.
Elderly, pregnant. Go ahead. There was somebody else contributing.
I'll say, go ahead, Christy. Elderly, the pregnant, I guess either old or really young, people with a weakened immune systems due to like diabetes or heart failure, hypertension, people that live in close contact areas or in close quarters, like can't read, I think nursing homes, schools,
jails, absolutely.
Prisons.
Good. There's going to be a big thing in jails. Thank you for bringing that up. I wanted to mention that, as it has nothing to do with food safety. Does anybody know what condition presents in jails? Tons.
Pneumonia.
You're on the right path.
Tuberculosis.
Tuberculosis.
No, that
Lysis.
one. Yep, you're gonna see tuberculosis in jails, and it spreads quickly and it presents quickly. All right, good. So on our food safety, who our real group of people we're worried about is everybody, right? Because everybody in the world eats, so anybody can be exposed. Very good. On our what was I gonna say? On our interventions, give me an intervention.
Teaching proper hygiene.
Great. Educating proper hygiene. Good. What else?
Checking refrigerator temps and freezer temps to make sure food is properly stored.
Yep. And who's going to be particularly at risk for that?
Elderly.
Yep.
Would it be people with no, like didn't have power or access to
I would
refrigerator?
say like people
homeless,
poor or homeless, right?
Homeless, well, homeless for sure, because you know they don't have a stove, but then I could probably have a refrigerator. Although we have an area out here, it's full of tents, and they actually have plug-in heaters. It's really fascinating. There's an area outside, right around Denver, and they have, it's called Tent City, and they have all these tents set up, and then they have figured out a way to get electric to their food, an electric. One person will figure out how to get to the electric and one person will figure out like how to get it warmer. I mean, sometimes they build the fires, but yeah, good. Think about that. Food safety for the homeless. Huge, 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 because they're eating whatever, however, right? Whatever they can get on. All right, good. So if we were thinking about what else? Big on wash your hands with water, food handling practices, good, contamination. This is a big one. And we saw it come across with COVID too. What happened in restaurants related to COVID and safety? Not necessarily food safety, but my thought is if this was going on, then other food safety was probably.
Just the spacing that they were putting in between the walls that they put up, like the screens and everything.
Okay. What did we see that was a problem though?
Say for negative, you can't eat with a mask on. So a lot of times people were going in and not wearing facial protection, and it was spreading like wildfire to the point places were having to shut down.
Right.
Staffing was short.
Good.
They weren't changing gloves because they didn't have gloves.
True.
Yeah.
They weren't changing gloves and it was spreading like wildfire. So think about food safety and that. If you have someone who is handling the food for a college cafeteria and they are serving all the residents that live there, chances are you're not going to have one kid that's sick. You're going to have 30 or 40 with whatever they had because the food wasn't prepared accurately. What's a primary prevention we can do with food safety?
Hand washing.
Educate on hand washing.
Good. Who are we going to educate?
Chefs, the people who are handling the food.
Everyone, because everyone eats.
Good. Everyone eats, and those people that are preparing, and I said this to another group, I think you want to think about that like first orientation to a restaurant, right? We want to talk about food safety to those people and teach them before they are being exposed to handing it out. Right? All right, good work on food safety. I wanted to add something to food safety and I can't remember now what it was. Let me think. It had to do with water safety. All right, I forget. Well, there you go. All right, so we're moving on to natural disasters. This is fortunately something that we see nowadays lots of different ways.
It was kind of hard. It threw me off a little bit. Natural disasters could be anything ranging from hurricanes, earthquakes, extreme heat, flooding, lightning, tornadoes, wildfires, anything that could affect your community, could cause destruction, things like that.
What did we see about a couple months ago, maybe 2 months ago on the West Coast? Maybe 4 months ago.
That the wildfire.
And what did that wildfire do? Did it just stay in California?
No, it spread.
Spread everywhere. The air quality, and I'm not close to California, the air quality here was horrific. You could see the haze for days. And so think about how that's impacting and how many people that's impacting. Who are we going to worry about with something like a wildfire?
Well, you're going to worry about like elderly people with no transportation, people who don't have family, wheelchair disabled people,
people with respiratory issues.
Yeah, immunosuppressant.
Yep. Respiratory. I want you guys to think about those respiratory conditions. Because if you're asthmatic and then you are in air quality that's terrible, are they going to be able to function, right?
No.
All right. So what is some education we're going to do?
We went with like the preparedness, something such a hurricane, for example. You'd want to stock up on food and water, supplies, flashlights, generators, your medications. One of my group members mentioned make sure you get ahead on your medications for however long. And then your shelter in places, staying away from windows, finding a central location. That would just be hurricane kind of based. But
It's kind of similar with a lot of the natural disasters, because even with snowstorms, whenever you're shut in your house, you want to make sure that you have plenty of blankets because you may not have heat for a while.
Okay, and you guys are coming up with something that I'm really happy with. You're kind of all, you're both coming up with it independently. What are we gonna have families do? That would be a primary prevention.
We talked about them having a plan, just having a plan in place and making sure that everyone knew where to meet or everyone knew what to do in case of an emergency. Like they should have like a safety meeting at home, have a plan.
Good. What else are we
Evacuation
gonna
plan and
have?
supply kit.
Good. Tell me more about the supply kit.
You
We
just
talked about batteries, water,
non-perishable foods,
non-perishable food, yeah.
supplies such as first aid kits. If you have pets, you want to do food, things like that for them. Medications again goes back to your kit.
And it's
Yeah, 'cause some
it's
of the
very
natural
important to have
disasters,
I'm sorry, what was that?
that some of the natural disasters you have, I guess you have plenty of time to prepare for, like a hurricane, for example, and but then other ones, you know, you kind of always have to have something.
Yeah, so you, right, so we want to teach our families, even if we're going into the house for needs assessment, we want to talk to them about having them self-prepared, because very good, and I appreciate you said that, we're not really prepared for natural
Yeah.
disasters.
A lot of the
Yeah.
teaching that you do is if you live in an area that you know that has sinkholes, if you know that you have even something that may not be, quote, a natural disaster, but when it snows up north, people that live in the south don't really know what that's like. So keeping cat litter, even though you don't have cats, sand, things like that, to help with traction, to get your car out of the driveway, to get you wherever you need to go. So a lot of ours were having the preparedness even when you don't feel like you're prepared. And it's almost like having a go bag for if you ever have that emergency call in the military or as a medical professional of, we need you, this is what's happening, you leaving tomorrow.
Yeah, good. And we
What is
talked a little bit
important
of,
too,
go ahead, what?
that they teach the family that have the important document in a container that is not permeable to water, and have it in a safe place or a place where everybody knows where it is, like the documents, the health cards, pictures of how was the house before, what is inside, for insurance matters. So the titles of some important belongings, that is very, very, very helpful.
Good, good. You guys worked really well here. Shelter in place, reviewing that with schools. It's a big one. They do a lot of drills. That's to prepare just in case, right? Now if shelter in place has taken place in a school, that just means everybody's got to be inside. That means something's going on outside. It could have nothing to do with the school, but something's going on outside. So think about that. You want those kids ready to go, so that when that happens, that disaster happens, they know what to do, okay? Very good work on that one. And then we have one last one, which is safe water. And I just remembered what I wanted to bring up about, we talked about fishermen being exposed, and we talked about food safety. What's a food that we are going to worry about that has a contaminant in it, that has always,
Chicken?
it swims around,
Fish
swims
in the
around.
mercury.
Tuna.
You add
Mercury.
mayonnaise to it a lot of times. Somebody just said it.
Tuna.
Yeah. We're gonna worry about our mercury in tuna, right? So if you ever look at the containers, a lot of them say it does not expose to mercury or whatever, so you assume that's correct. But what happens if in that food packing plant, they haven't done what they need to do, and then it's a trickle down effect, right? So we want to think about that. Good work. All right, safe water. What can you tell us about safe water? Anybody? Is safe water sleeping at this point?
Okay, it's important to teach people that many agents, bacteria, virus can reproduce in water. So test the water that you are drinking, the water that you are cooking, at least, periodically. If you live in a rural area and you need to accumulate water, have lead containers that are with a lead. Teach them that mosquitoes are transmitters of many diseases and they reproduce in accumulated water. What else? Oh, don't contaminate the water sources like rivers or fountains or,
Good. And I see here on your secondary and tertiary, you guys put boiling water before use to rid contaminants, which is good. And I'm gonna have to say that would be secondary. Because if there were some exposure there, that's when you're gonna do it. Remember, tertiary, you have complications already.
Yeah.
So you're not gonna have complications. Well, I mean, you will by the time you're at tertiary, but boiling that water is gonna reduce the complications, right?
Yes.
All right, so good. I want you to think about that. And I really wanted you guys to do those primary, secondary, and tertiary prevention because this is a big chunk out of your exam. And I like how you guys are coming up with different ideas, okay? And you've done really well on this. All right, you guys did an awesome job. And I hope you like that. That was just a little more interactive for you guys as opposed to hearing me. And you guys told me everything I would have told you. So there you go. Awesome job. All right, I'm going to give you guys a break. It is 9:10 your time, or 9:09. So let's come back at, I'm gonna make it short tonight because I want to make sure we get through everything. And then if we're done early, we'll leave early. Okay, is that fair? All right, so let's give ourselves like 6 minutes, which will take us to 9:15. Good? Okay, I'm gonna stop sharing and I'll be muting. All right, guys, we're coming back. I usually like to give you 10 full minutes, but I just want to make sure we get through everything tonight. All right, our next chapter is on epidemiology. Now, I will tell you, it's very, very vocabulary heavy. And what that means is there's a lot of information in this chapter. But what I'm going to do is I'll do it with you guys from a PowerPoint perspective. I'll tell you what I need you to really focus upon. Epidemiological studies, it's advanced studies, you know, it's not something we're necessarily going to do as an RN. We'll certainly do it, you know, will certainly help to look at our different causes or and the other things that are going on. So let's take a look real quick. I'm going to share with you a PowerPoint. And the PowerPoint that I'm using tonight is actually from CDC. They have a really nice one. I'll put on the slideshow. All right, so it's just an introduction and it tells you that I can use it. So when we're looking at our epidemiology, what we're really looking at is what's going on, how are things interacting, and what's the cause, and how can we help it? Okay, so we look at what's the problem, we look at what's causing it, what can we do to fix it, and how do we fix it? Okay, so we're going from identifying the problem to helping to fix it. Okay, that's really your epidemiological spectrum, we should call it. Okay, so when we're looking at what's involved here, it's not just one thing. Okay, we're looking at our public health, which is our epidemiology, is always surrounding our public health because we're looking at causes, agents, hosts, those kind of things. We look at surveillance, we look at informatics, like what kind of data can we take? What can we see in the lab? And what is most effective? How can we prevent it? Okay. So our study of the distribution and determinants of health-related states among specified populations and the application of that study to help that problem. Okay. That's really what we're looking at here. So our big thing that I want to focus on tonight is agent, host, and environment. Okay. These are all going to play a factor. This is out of your book. I'm going to bring it up for you from your book actually right now. But anyway, discover your agent, your host, and your environmental factors and how is that impacting it. So we're going to stop this for 1 second. I'm going to pull up, show you in your book. Your book has a really nice picture of it. That's why. And it's on page 132. Oops. Hey now. Why didn't it went to 154? So 132 has a nice diagram of our agent, our host, and our. No, it's not cooperating with me. Hold on. This I want you to be very comfortable with and know very well, okay? I thought it was on 132. The book won't let me go to the page for some reason. Hold on. All right, so we talked about it's our different determinants and what factors influence what's going on. So there's a whole bunch. Like I said, this is a very heavy chapter. But I really want you to focus on with epidemiology. We're really looking at what's causing something, what's able to take it on, and then how does our environment impact that? So when we take, no, what? That is not right. 130, oh, sorry, it's 139, no wonder. All right, let me go to 139. Oh, how annoying, so sorry guys. I don't know why. All right, so anyway, we have our host, we have our agent, and we have an environment, okay? So our agent is, they all work together. They're a 3-member family like this. And what they do is, hold on, let me see if I can just find it real quick. I'm really sorry. I don't mean to waste your time, I promise. I had it pulled up and now it's not here. Okay, anyway, we have our agent, we have a host, and we have an environment. And so it has to be, how do these 3 interact? So what I want you to think about is think about COVID. And what we saw was some people were infected with it. Their environment changed how they responded to it. And then we had our host, which was the virus, and that decided to attack certain people. Now, it did spread, right? It spread around like crazy. But when it did, can anybody tell me what you saw happen with it? Did it spread evenly, all the same? Anybody?
It seems-
Anybody? Go
It seemed
ahead.
to affect areas faster than others.
And symptoms were different for everyone.
Good. They were different for everybody. And sometimes we looked at it and we said, why is this person getting it and not this person? Why is this person dying from it and this person isn't, right? So what we really want to think about when we're looking at any illness or any thing that's affecting our community, and we're looking to see what's going on here, why is it happening? These are the 3 factors that we're going to look at. Here's a little nice picture. Thank goodness I found it. Okay, so we have, it looks like a triangle really, okay? We have our host, we have our agent, and we have our environment. When we're looking at any condition, we have to have.
Miss Alani, are we supposed to see your?
We're not seeing it.
Yeah.
Oh, you're not? Thank you for telling me. Hold on. Here it is. Can you see it now? Can we see it? Good. Okay. Thanks, guys.
Yeah.
All right. So we have our agent, and our agent is going to be that thing that has to be there to have something develop. Okay. And then we have our host, which is the person or the animal that's able to be infected by it. And then we have the external environment, and how does that impact the agent and the host? Okay, so this is another way you can look at it. Our environment surrounds us, right? It's in a big, nice circle. So our agent and our host are going to be impacted by our environment. So examples of our agents are going to be infectious agents, bacteria, viruses, parasites. We have chemical agents like we talked about, toxic chemicals. Our pesticides, where are we going to see those pesticides, and where are we going to worry about this agent? What community?
The migrant workers.
And then we have our physical agents like radiation, like cold, like machinery, like heat. Okay, so these are all the things that can get in there. Then we look at the host. And with COVID, we saw initially, and then, you know, I mean, there was so much data, and I'm not even sure how much of it is still consistent, but we had those people that were older, right? And so, and those immunocompromised people, and those were going to be more susceptible. When we think about hosts, also, there's tons of research out right now with genes and how that impacts. You guys should have heard about a BRCA gene that's been in the news probably about 20 years, maybe. And this is a gene. And what they find is if you have the gene, you're highly susceptible to get something else, okay? What are some other conditions we've seen that are genetically driven in our med surg time? Think about any conditions you've heard about that have genetics, like if you have it in the family, chances are.
Breast
Heart
cancer.
disease and
Sickle cell.
cancer.
Diabetes, high blood pressure, sickle cell anemia.
Sickle cell anemia.
Good. Sickle cell, breast cancer, diabetes, high blood pressure, high cholesterol, right? All those, if you have it in the family, you're more susceptible to it. Now, I want you guys to remember, if you're evaluating a patient and they're adopted, are we going to necessarily know their genetics? Maybe, but maybe not. So think about that when you're assessing and saying, well, what comes from your family? And if you're assessing a teenager, and they say, well, mom has this, dad has this. Nowhere in the whole conversation did they say that they're adopted, you know? So keep that, you know, really, you need to make sure when you're doing these type of assessments for genetic screenings, you're going to look and see. There's a lot of genetic screenings that are done before, when you're pregnant or as you get pregnant, right? To see, is your family, are both man and woman, are they coming from Jewish descent? Because they are more susceptible to some conditions. So I want you to think about that. All right, and so then some other characteristics. If you're older, some women are more likely to get things that men are. Obviously, something like prostate cancer, you're not going to get as a woman. So you can eliminate them when you're looking at our hosts. Acquired characteristics, so our status, like immunological status, and our lifestyle factors, like do we not exercise? Do we not diet? We're going to be more susceptible. We're going to be more ready. The body's going to be ready to say, I'm tired. You're not treating me right. So what is going to happen? And then we look at our climate, which is going to be like our temperature. What are we around? Is it really crowded? All those things. Okay. Socioeconomic status and working conditions. Are we really stressed? You know, I want you guys to think about cardiovascular. Who do we see is at a high rate of cardiovascular disease? Somebody who has it in the family, somebody who's stressed at work, somebody who's decided that they don't want to exercise or diet, somebody, you know, all these things, right? And so do you understand how they all interact with one another? So when we're looking at the study of diseases and the study of health risk factors and conditions, this is really important here, our 3 facts, okay? So any questions on that? I like the picture that we have right here. Everybody see it? Immunizations are an integral part of primary prevention. We have to be careful with our environment. Who are we vaccinating? Meaning, are we vaccinating the general public? Are we doing something to prevent? But most immunizations are always going to be primary. All right, so that, sorry, we'll go back. I got a little distracted there, but we'll go back to our all right, so we look at with epidemiology, we look at the importance of illness, disease, and evaluate our programs that we use. So our first step is going to be, we're going to surveil, we're going to do our data collection, we're going to collect everything. Number 2, we're going to see what's going on. Number 3, we're going to say what's our agent, our host, and our environment. And then we're going to take an intervention, and then we're going to reevaluate again. Okay, so it's a big circle. So when we talk about the studies and things like that, you're going to see in the book too, they talk about epidemics and outbreaks, like the one we've been through, which is not over and far from over. The numbers are ridiculous right now here anyway, but pandemic, and we see it's across regions, but didn't we see a spike in different states? So our environment really impacted that. First, they said sunshine, like would take it away or prevent it, and then take all this vitamin D, and then they don't really know, right? But we've seen lots of pandemics across our time. So malaria is going to be an endemic, and because it's the presence of, it's in Africa all the time, and so it's going to be an endemic. On our epidemic, the Ebola virus is a good example because it was too much for what was normal. And then we, of course, have our pandemic, which prior to COVID, HIV was the #1 pandemic that we heard about. Okay. Something with epidemiology, and the book talks about it, is how we figure out rates. So the way we would figure out the rates, and this is important to know, is we would look at the number of cases, we divide it by our population, and then multiply by 100. You know, that gives us our percentage. All right, so here's a nice little scenario. In July, there was unexplained pneumonia in these areas. It was a convention.
Or are you?
But
no.
What'd
Are
say?
you looking at screen? Because we see CDC.
Yeah, the blue screen. Unexplained pneumonia. Is everyone see that?
We're only seeing the
CDC.
center.
Yeah. I'm so bad at this. What's going on tonight? Okay, better.
Yeah, now we see it.
Better.
All right, so sorry, guys. You have to stop me if I'm talking endlessly and you don't know what I'm talking about. Okay, so in the middle of July, we had this convention in Philly, American Legion Convention. From the 26th to the 1st, we saw 18 deaths that happened. Okay, now it won't let me move. Okay, so a healthcare provider at a veterans hospital in Philadelphia calls the CDC and says to the CDC something's going on among these attendees. By the evening, there was 71 more cases reported. Okay, what we looked at here And this will exemplify it for us. When we're looking at our epidemiology and our agents and our hosts and things like this, we looked at ages here. We had out of our group, the largest percentage, okay, because they had the smallest number with the biggest amount of people. See up here, 40 to 49, they had a total of 160 people, but out of that, only 9 got sick. Then we look at 50 to 59, we had 320, only 27 got sick. But down here, we had 54 and 11 of them got sick. So what does that tell us about our agent, our host, and an environment here? Tell me, what's the environment?
The hotel.
Yep, good, the convention. What is our agent? They told you kind of in the title. If you forget, it was.
Graciela Legionari.
Yeah, it was pneumonia, but you'll see why in a second, I think. And then remember our host. So who's our host who's highest at risk?
People 70 and greater.
Yeah, the older people again. That's terrible, right? No point in getting older. I see no fun in it. All right, so then we take a look at that, and this is some epidemiology for you guys. So, okay, hold on. They're just telling me. All right, so we're going to do this question. On day 1 of a technology conference in San Diego, 15 presenters who were setting up their sessions became ill with flu-like symptoms. During the course of the conference, 20 who attended also became ill with the same symptoms. How would we calculate the rate? What are we going to figure out first?
How many people it entailed?
The number of cases, right, that we see, right? Because we're going to have to do our rates then. All right, we're not going to go through this. This is too much. And I don't want to run late, but I kind of like, all right. I really like some of this stuff because it gives you a really nice way. All right, so here's some ways that we would do, we would look at our data sources. We ask questionnaire surveys. We sample the environment. We go to the health department if cases are observed. Non-related, we look at court records, sales records, okay? Things like that when we're looking at our outbreaks. No cross-sectional studies. There's a certain population at a certain time. And then we're gonna stop on that one. On our, there's a ton of content on this chapter. So what I want you guys to do is focus on what we went through tonight on it. But I also wanna show you in your book, if you were looking. Oh, I'm not sharing yet. See, I'm really slacking tonight. Sorry, guys. All right, so when we look at it, we look at, you are gonna see tons of things. Here's where we talk about, and we brought this up, but this isn't with TB, but in our jails, this is like what happens. There's an outbreak. We have to figure out why, who was most susceptible, how many people got it, what was going on. That's what epidemiology really is. I like the examples they give here for secondary prevention, early and periodic screenings for illnesses like breast cancer, okay? And then we're going to look at tertiary, and we're going to make sure that we are giving medical treatment, physical and occupational therapy, and rehab we're helping, right? Okay, and so when we look at how we're going to assess, we talked about this, surveys, comparison groups. For an individual, I want you to remember this is going to be on our assessment, obtain a history and physical. We talked about that with all of our environmental things, right? And then we do a little bit about the different types of studies, which are right here. The first one is our ecological. It's going to be easy, quick. What it does is it sort of just gives us a basis. Then we go cross-sectional, and so we're going to look at you know, populations and what happened and how were they related. And then case control, we're going to look at smaller groups and how are they related. Okay, so it gives you a nice little description of these in there. All right, so there's a lot in this chapter. I kind of tried to focus you based on what I think is important. I want you to remember when we're doing studies, there's a big part of it that we didn't talk about, and that's going to be our ethics behind studies and our biases when we're doing them. We have to be really careful. We've talked about this in other topics to watch what's our ethical demands. How are our biases going to impact who we're asking and how we're asking, right? And so we have to be really careful how we're selecting people for a study and make sure that we are very set and that control group is our control group and the, you know, experiment A is with them and B is with them, okay? So yeah, like I said, I don't think you guys would do a lot of this unless you're a little more advanced, but it is something that's really important in community health because what we look to see is why are these things happening and how can we prevent them? So like for our primary prevention for cardiovascular, we talked about this just a tiny bit, but low fat diet, physical exercise, we're going to tell the whole world that, right? And if you've watched anything on TV, they always talk about, oh, exercise, they have the Peloton, they have this, that, whatever, you know, all these gyms now, the dual physical exercise and how great they are, right? And then you were going to look at cholesterol and blood pressure screenings, maybe do a stress test if there's some risk factor there. And then once you have it, you got to do medicine, you got to do surgery in order to get your stuff to help them. Okay. So big thing here, epidemiological triangle, our agent, our host, and an environment. I want you to know the examples that we had in the chapter that I highlighted for you. That was back on page. And the reason I want you to know these, you don't have to memorize them by any means, but I just want you to have them in your head. So when you're thinking, what could that be? It's box 9-1. It's page 139 in your book. Okay. Any questions on that one? All right, we are going to move into occupational health. And with occupational health, somebody tell me what they think it is.
The health of the people in their place of work.
Okay, and who's had any experience with an occupational health nurse?
Oh, I have when I was doing my GS position.
Good, tell me about it.
They just did a physical and made sure we were like up to date on vaccines and eye test and ear test.
Yeah, if you've ever worked in a hospital, you've had an occupational nurse check you out before you start. Probably nursing homes as well. But I want you to think broader, bigger spectrum. And something that came up that's been interesting, I'm going to show you guys 2 videos on it, but one is how COVID impacted this population. So nurses across the board, we know have been impacted by COVID and everything, but think about these occupational health nurses. So they're going into these places and working as a nurse. And do you think they have the same access that those nurses, now they're being exposed to the entire population, right? Do you think they were given the same means and the same PPE and the same everything else that was being distributed to schools and to hospitals? Do you think they said, make sure the lady at Merrill Lynch, because there's a nurse that works with Merrill Lynch, do you think they were giving them PPE when we were fighting to get it from everywhere? No, and you really saw that impact. So we're going to watch a little video on that and see how that impacted our occupational health nurses. So I'm going to stop sharing and then I'm going to share again. And here we go. Oops, hold on. Oops. Uh-oh. Hey now. Why did that do that? Okay, here we go. Everybody can see it, right?
Yes.
Okay.
Ontario enters phase 2 tomorrow, occupational health nurses will have a huge challenge ahead of them, ensuring the health and safety of workers to minimize a possible second wave of COVID-19. For more, we're joined by Lena DiCarlo, occupational health nurse and former president of Occupational Health Nurses Association. Good to talk to you today.
Good morning.
Okay, so let's talk about occupational health nurses. Do not work in a hospital every day like other healthcare workers, and so people might forget or possibly not understand the risks you face, especially in a pandemic. So what are those added risks?
Well, first of all, we do have occupational health nurses that do work in the healthcare sector and in manufacturing and other industries. So the risks are really somewhat the same in the sense that we're managing potential cases, we're managing the fear of our employees being exposed, having them understand what the pandemic is all about and what preventive measures they could take. So you sort of the foundation of what we do is really to maintain, promote, and restore health and safety in the workplace. So as frontline workers take care of patients, the workers are our patients. And so we're advocates for them. So we work very hard with key players in our organization to put the right kind of systems in place to protect them from all kinds of hazards, including communicable diseases. So this pandemic is unlike anything that we've seen, at least in my lifetime. And so having the right kind of processes to protect them is really important. So it's been quite a whirlwind since February.
Yeah, absolutely. What are you most worried about?
Well, I think the mental health state of our workers and having them have the tools to navigate this difficult time and know that employers are doing as much as they can to protect them. And as occupational health nurses, that's really what our forte is to guide, to facilitate, to promote, to understand what kind of processes you need to put in place to safeguard the health and wellness of our employees.
And what about compensation too? I mean, in April, we know the Ontario government announced a pay bump for healthcare workers on the front lines, but occupational health nurses were not included on that list. Did that surprise you?
It did and it didn't. I think there is a lack of awareness of our specialty and what value we add to organizations. And so was I disappointed? Yes. I think as an organization, we work very hard to be strong advocates for health and safety of the workers, and we put ourselves at risk. We're working very hard. We're navigating this whole world with employees, managing their exposures, their illnesses if they've acquired the disease. And so it was a disappointment, to say the least. And I think this is a good opportunity to sort of showcase who we are and what value we bring to the organizations.
So what changes or support would you like to see from the provincial government?
Well, I think that an awareness, first of all, of who we are and what we do and our value in the workplaces. And most leading employers have occupational health nurses on site, but there are many who don't. And so they're left at risk. So I believe that bringing about an awareness and being acknowledged for the work that we do to safeguard employees, because if employees aren't there to do the work, then who's taking care of the business or who's taking care of the patients?
Lena, we do appreciate all the work that occupational.
All right, we're going to stop right there. She just says thank you and whatever. So that was a perspective, a Canadian perspective. But I think what I really wanted you guys to pull out of that was occupational health nurses are kind of overlooked because they're not on the front line, but really they are on the front line, right? They're being exposed to just as many people as a nurse, any other type of nurse. So they're really special people. They do tend to get burnout though. It's mentally, they're dealing with everyone's problems and they all work together. So you have to really be careful with their mental health and how they feel about it. As an occupational health nurse, what are you going to look at when you're looking at what kind of things are you gonna watch for in your company or in your place of employment? I think Margarita, you suggested a few, but think about it.
Just like employee safety. I think they even do like ergonomics, like let's say you have a job where you're sitting all the time, you want to make sure you have like proper ergonomic chairs and things like that.
Good. Yep. They're going to be doing some like primary prevention, making sure that those desks are at the right height, that the people who are standing or sitting, right, to minimize. How about thinking about like the workstations at the in a hospital or a nursing home? They're going to try to make them as pleasant as they are to keep the employees comfortable, right? We want to think about what kind of noises are going on, particularly in a very loud area with factories and things like that, right? We want to focus on those a bit. We want to make sure that we providing our as occupational health nurses, you want to make sure you're providing as much protective gear as the people need. If that means earphones because they're in a loud factory, if that means wearing safety vests because they're, have a potential of being harmed or they need to be seen, making sure they have good shoes on, things like that. So we really are, as occupational health nurses, we're keeping them safe. We're assessing the community that we're in, right? We talked about TB in jails. So I don't know if anyone has experience, but I do have a friend who worked as a nurse in the jail. And she dealt with a lot. They come to the nurses for lots of different reasons. They come to get out of their cell. They come because they're injured. They come because they want somebody to talk to that's not in uniform. They come because of all kinds of reasons, right? And those nurses have to be on their game, I'll tell you, and know their protection and know what to do. Because she worked with men and found that was easier, but oftentimes male nurses will work with the women in the prisons because that separation kind of gives them a little more impact, shall we say. So, the men come to the women and there's not that, struggle for I'm here and we're equal or anything like that, right? So we see that a lot in occupational health nursing, that particularly in jails, we'll see just the opposite. And so and they're protected, there's a safety, a safeguard there and stuff, but at some point you have to also remember that these are patients, so the nurses can't violate their HIPAA commitments to them. So sometimes the security guards are sworn to not say anything, but might a client not say something in front of the guard? Oh yeah, he may not want to get somebody else in trouble, or else he knows he's getting in trouble later by the guy he ratted on, right? So think about that when we're thinking about occupational health nursing and how impactful that can be. Not a place I would ever work, I'll be honest with you. And my friend she was 4'9", so she was the shortest, littlest thing you've ever seen working in a male jail, but she liked it. She did it. She was fabulous at it. And they didn't really try to intimidate her, which, she enjoyed that. So think about, go ahead.
That the nurse, the occupational nurse, at the same time, because you mentioned before that she assessed all the convenience for the employee. But I think it's very important that she also assess the habits of the employees, because for just one that go to the bathroom and don't wash their hands, the vomiters, for example, the doors or the thing, or if the guy that is cooking in the jail has no good hygiene. So it's important that the nurse assess the habits and teach them how to correct them.
Good. Yeah. I like you thinking outside the box a little bit, and that's exactly what they do. So they're really taking care of an enormous amount, not just the people, but I like you brought that up. The environment, is it safe? Is there mold in the ceiling? Are we getting, conditions across the board in an organization? So really important to think about. And occupational nursing is under not put in our scope. You know, they want to make sure, and occupational health nurses will follow up on those on those workers, which are their patients, but like, why are they missing so many work days, right? Remember, one of our Healthy People 2020 objectives was to reduce the amount of missed school days for kids with chronic illness. Those occupational health nurses are going to look to do the same, right? Reduce that time, and nursing will reduce that. And is there something going on that's making, you know, people call out more because they feel uncomfortable or their mental health is being violated at work, you know, all those things. That's the job of the occupational health nurse. So it's multi-spectrum. There's a ton of it. There's so many different opportunities. And I know
What
you guys
about
have
when,
been exposed.
I'm sorry, what about when employee has addiction problems or alcoholic problems and goes to the work in that state? Then the occupational nurse should intervene there too?
Well, I mean, depending on what kind of job, it might be a little too late, but yeah, they would intervene there, of course. I mean, I don't know if anyone has experience with nurses, unfortunately, that have used drugs or alcohol on the job. And so what ends up happening to those, so what happens to those nurses is they go right to, it's called OC Health. It's Occupational Health Office. And in there is nurses, you know, who work in that environment, and they assess. And then can they counsel them? Absolutely. What level of prevention would counseling be?
Primary?
Mm-mm. If you're sending somebody who's already addicted, they're already, if you're sending them to counseling,
Tertiary.
good. Any of those rehabs, those counseling groups, all that, that's always going to be tertiary because they already have it. You know, if they're sent to the OC office because they were shooting up something in the break room, they already have that problem, and there is not a whole lot you can do to minimize the problem because they're actively in it, right? So rehabs, all those are going to always be tertiary. There is an organization, the National Institute of Occupational Health, and they will be our regs and, you know, regs for that type of nursing. So as far as occupational health nursing, what I want you to know is what we see with them, some of our, what's likely to happen with them. And then we're going to look as an occupational nurse, how do we keep the environment safe? We're going to look at if there's an outbreak, who's our agent, who's our host, and we know the environment is the workplace, right? And are we giving our people, our clients at this point, they're people who are working in whatever environment you're working in, are we giving them a safe place to be? Is it safe mentally? Is it safe physically? Those kind of things. Okay, so that's really important. And occupational health nursing is often overlooked, but it's a really special and unique field. So that about covers our 3 chapters. It's not everything in the chapters, I will tell you that, so make sure you're doing your review and stuff. Let's take a quick look and then we'll be done for the evening. I'm sorry I took you guys to the end, but I'm going to share my screen with you real quickly. We know that next Thursday, everyone will be at class. I'll be here too. We're going to take our exam. We're going to have our 2 pieces of technology ready to go. 6 o'clock. 6:05, I cannot accept you into the exam. So I need everybody here. I'd say be logged on by 5:50, just 5:50-ish, just because there's always problems with technology. You know how that works. So if you have any problem, I expect you to text me for any testing problems if we're doing the test. What else can I tell you? 2 places of technology. It will be recorded. Don't cheat, please. It's a real pain, and it does nobody any good at all. I've told you guys before, when you sit for that NCLEX, there is no cheating. You don't even have a choice, because I would love to see the way you would cheat for an NCLEX when you have no idea what's on there. You know what I mean? So our study guides, again, remember, they're really helpful. Go to a review session. I'm holding one tomorrow at 6 p.m. Eastern Standard Time. I'll figure out what's going on with the recordings, why they're saying private. I will record my my review tomorrow. I will record it as a Zoom link if I'm allowed, but they really don't want us doing that. But I feel like for a review, we want to make sure everybody can access it. You can go to anybody's, and we will be taking attendance at review sessions, so just know that. Okay. What else?
I had
can
another instructor that is having issues posting her YouTube videos too, and she ended up having to take the password off and in order for anybody to be able to access them today.
Oh, thanks. All right, I'll text Dr. Lundy when I'm done with you guys and just say what's going on. Okay, so they're locked. I don't know. So usually I much prefer Zooms, just record them in Zoom and then post the link and then we're good to go, but that's no longer the way we can do it, so is what it is. For this week, let's take a quick look and see what we have due this week. You guys should have gotten something into me last night. I think as I'm remembering correctly, let's take a look at our modules. I'm going to share my screen. I know I'm not, so hold on. Now we're looking at our week. Yeah, we're on week 5 here. Discussion questions should be in. I said the 7th, but because we meet on Thursdays, I'm not really too flexible on dates, but I know it gets confusing. So this was due Wednesday. The reason I extended it till Sunday is because you have to respond to 2 people. So it was really due yesterday, but if you misunderstood because of the dating, just send me an email or a text and we'll work with it. So our discussion question, we have our NCLEX review questions. This is your second time around. Please email me because I have to send you special instructions, but we should be at that. And then our live attestation due tomorrow, right? Any questions? If you want a private review, just let me know. I'll be able to do that for you. Are we good? Everybody exhausted?
Yeah.
I'm going to say yes, because I know I am. All right, guys, have a great week. Get your assignments in, please, on time. If anything you need, you know how to reach me. All right. Good night, everybody.
Miss Jennifer? Miss Aloni?
Yep. I'll stay on after everybody cuts off.
Okay, you send me an email that said.
Hold on, Margarita, hold on 1 second. Let's get everybody out of here first. Lauren, you have a question?
Real quickly, our meeting, you want to do it before the exam, so 5:15?
To review?
Yeah, because remember it's mandatory.
Yeah, I know it's mandatory, but I have 2 things out there. Did we go over your test?
Together? No.
Let's meet at. Are you going to the review tomorrow?
I will not be able to make it because I have class.
No, don't worry about it.
Because
let's
it's
do
6 my time, not your time, right?
Yeah, I know. Yep. All right, give me a time that's good for you this week.
Well, can we meet before 6 since you were going to be on anyways?
Before 6, yeah. I leave work at 5 my time, so I can do it anytime before that. I'll just take lunch and do it with you. You want to do it tomorrow?
The review before? That's fine.
I mean, it's up to you. What's better for you? What works next week then?
Monday?
Okay, what time Monday?
Anytime.
Let's do Monday at 2:30.
Your 2:30 or my 2:30?
You got me. I know. 2:30 your time. I'm trying.
2:30 my time?
2:30 your time. I'm gonna put it in my phone right now.
Okay, Monday
2:30 your
2:30.
time. So it's 12:30 my time. I'll do it at my lunchtime.
Okay.
Okay, I'm putting it in right now. Don't hang up until I put you on my calendar, okay? That way there'll be no confusion. And if anything comes up, like I might be a couple minutes late if there's an emergency or something, but I'll be there.
I'm gonna
So
have your phone
Monday
number this
the
time.
8th. Monday the 8th, and we said 2:30 your time, so it's 12:30 my time. Good?
Yes.
Great.
I have
All
your
right.
phone number this time, so if you're
That's
not
right.
there
You
by...
got the right number. You can text me.
All right, thank you. Have a good
All
night.
right. You too.
Bye.
Bye-bye. Hi, Hetty, do you need something? No, I know it's me and you. I think Hetty shut off or something. I'm gonna put
No,
you in.
I'm sorry. I can hear you. I can hear you.
Oh, okay. Do you need something?
No, I am gonna text you though. I do need to talk to you. So I won't text you today. I'll text you tomorrow if that's okay, because it's late here, but
Yeah, it's fine.
okay.
Okay.
All right, thank you.
All right, bye-bye. All right,
Bye.
Margarita.
You say that you need to meet with me.
Yeah, we have to go over your last test because you didn't pass the test.
I didn't pass the test.
Mm-mm. No, you gotta, hold on, I'll tell you in a minute. Yeah, you got a 60 on the test.
60?
60.
Okay. So when I can meet with you?
What works for you? I want to go over that test and I want you to do a one-to-one review with me for this next exam, because getting a 60 on the first exam puts you far behind, you know?
Yeah.
So, because you have to have a 78 average on your exam, so you'll have 3 more to go. You have your HESI and 2 more.
Yeah.
So I want to go over your test and I want to review for this one. What works for you?
If you want tomorrow in the lunch hour, you can do it.
Yeah, sure. I can do it in my lunch hour tomorrow. That's 2:30.
2:30?
2:30 your time.
Okay. Perfect.
All right. So I will join on. It's same as I said to Lauren. If I'm running a few minutes late, it probably just means that I have an emergency or something, but I'll be on. And take my cell phone number, please, and write it down.
Okay.
It's 732.
Yes.
857. 7188. If anything comes up, you can
Alright.
text me. If I'm not on by like 12:40, which would be 2:40 your time,
Okay.
just give me a text and make sure that I'm not in an utter emergency.
It's okay.
Okay.
All right. See you tomorrow.
All right. I'll see you tomorrow. Bye-bye.
Thank you. Bye.
Bye-bye.